I am Asim Joshi, PhD student in that laboratory at ACTREC. So the topic of my talk is efficacy of weekly osimertinib dosing over daily dosing, a comparable response using a mouse model for the ADURA clinical trial. So to begin with, lung cancer is one of the most common cancers and is the leading cause of cancer-related deaths across the globe. Now, among lung cancers, we have a specific subset of lung cancer, which is EGFR mutated lung cancer, in which the EGFR gene is mutated, because of which the lung cancer is driven. And from the studies carried out at Tata Memorial Hospital and in our lab, we know that the EGFR is mutated at a frequency of 23 to 25% in Indian population. Also, there have been number of clinical trials across the globe as well as in India, wherein what is established is that the EGFR tyrosine kinase inhibitors, they significantly improve the overall survival of EGFR mutated lung cancer patients. So now EGFR tyrosine kinase inhibitors are the standard of care treatment for EGFR mutated lung cancer. Now, over a period now, since the time EGFR was discovered, gefitinib, which is the first line, and erlotinib, which is the first generation EGFR inhibitor, they have been approved for the treatment, and also osimertinib, which is a third line EGFR inhibitor. It has been approved in the cases where there is resistance as well as in the first line settings. Recently, there was another trial called the ADURA trial, about which I'll be talking in my next slide. So now, the what ADURA trial established is the fact that osimertinib can also be used in the adjuvant settings. So what they did is they took the EGFR mutation positive early stage lung cancer patients, and they randomized them into two groups. One was to receive osimertinib and other was the placebo group. And they observed that the group receiving adjuvant osimertinib showed a significant improvement in the disease-free survival compared to the placebo group. And hence, and osimertinib was shown to be effective as an adjuvant treatment in EGFR mutant in early stage EGFR mutant lung cancers, which for which the tumors was resectable. Now we again went back to the literature and we observed, we went through some studies on the pharmacokinetics of this TKIs, the first generation erlotinib and osimertinib. So the point, I would like to draw your attention to this aspect, that what was seen is that even after 21 days, osimertinib could be detected in the blood and the brain of the rats which were given a single dose of osimertinib, and which was not the case with erlotinib. Erlotinib was, I mean, within 24 hours, erlotinib couldn't be detected, but osimertinib stayed in the plasma as well as in the brain for about 21 days. So now we raised a question that in the ADURA trial, can we have some, can we model the ADURA trial and have an altered dosing of osimertinib, since it stays in the plasma for up to 21 days, and can it have a similar effect to the daily dosing? So now our first thing was to have a model which could depict the ADURA trial. So we went on to to use the mice models. So now what is known is that if you inject uh, cells via the tail vein of the mice, they colonize into the lungs. So we tagged our lung cancer cells with luciferase so that they can be monitored, and we did try this way of injections, and we could see that the success it was successful, that all the cells injected into the tail vein, they could colonize into the lungs. So what we use is we use these models, and then we used up PC9 cells which harbor an exon 19 deletion, and we use them for tail vein injection. So these PC9 cells are sensitive to erlotinib and osimertinib. So now moving on to the actual study dosing that we did. So we took a group of mice and we divided it into three groups. So first was the control group, wherein no treatment was given. Second was the daily dosing group, wherein erlotinib and osimertinib, we pre-treated them, since it is a model to depict the ADURA trial. We pre-treated them, and then at day 0, we injected the tagged cells, and then we continued the treatment, and we kept monitoring the mice till to see the colonization of lungs. And so this daily and osimertinib dosing is depicts what was seen in the Adura trial. And then we took as an altered dosing, we selected the weekly treatment with this TKIs, wherein the TKI was given once a week. So now what we actually observed from this. So this is the control group wherein all the mice that were not given any treatment, we could see the colonization of cells in the lungs of the mice and tumor formation up to 18 days, and we also followed it up to 30 days. Now in daily dosing arm, what we observed is that both in case of erlotinib and osimertinib, there was a comparable response. So if you see at day 18, none of the mice in the osimertinib group showed homing over the colonization of cells to the lungs. Although one mice in the erlotinib group did show colonization, but still the response was comparable for daily dosing in case of both erlotinib and osimertinib. Now comes the interesting part, wherein for the weekly osimertinib dosing, we could see that erlotinib was not at all effective in preventing the colonization of cells to the lungs of the mice. However, on the other hand, osimertinib, we could see a efficient response when osimertinib was given on a weekly basis in preventing the colonization of cells to the lungs. Thus, while daily dosing of erlotinib and osimertinib could prevent the colonization of lung cancer cells into lungs of mice, in case of weekly, it was only osimertinib, but not erlotinib that could prevent the colonization of lung cancer cells into the lungs of mice. So now to
Dr. Asim, please conclude your talk.
Yes, sure. So to summarize, like the daily dosing regimen has a comparable effect in preventing the colonization of cells, while the weekly dosing, when osimertinib is given, even on a weekly dosing basis, it can prevent the colonization of cells to the lungs of mice. Now, the main impact that this can have is a direct impact to the cost of osimertinib treatment. It can bring it down by 1/7. So thus, what we propose is that the low dose, once a week adjuvant osimertinib could have, which is known to have could have a lower toxicity and a higher affordability, which is currently not the case. So with this, this study was published in Translational Oncology. I would like to acknowledge my guide, Dr. Amit Dutt, and our clinical collaborators, Dr. Kumar Prabhasha and Dr. Vanita Noruna. Then I would like to thank the director and deputy director at ACTREC, as well as Shilpi Dutt, my lab members, and animal imaging facility at ACTREC and ACTREC for support and fellowship.